The World Health Organization has issued a warning saying that an outbreak of Ebola is going on in Africa. So let's get over into that and see what this whole thing is about.
Now to a deep dive on the growing Ebola outbreak in Africa, raising alarms across the globe. The World Health Organization warns that the disease is spreading rapidly across the Democratic Republic of Congo, upgrading the national risk level to very high. There are at least 750 suspected cases and 177 deaths believed to be Ebola related in the DRC alone. Uganda also reporting a pair of cases and one death. The WHO says the situation is currently stable there, but Ebola is one of the deadliest diseases for those who contract it. And my next guest has experience with it firsthand. Dr. Ken Brantley was the first American to become infected with Ebola during the 2014 outbreak. You can see him here on the cover of Time magazine as Person of the Year. He contracted Ebola while leading a treatment center in Liberia. And over the last 12 years, he's continued that work to strengthen healthcare systems in underserved communities around the world. Dr. Ken.
That is someone who loves what they do. That is truly somebody who loves what they do and keeps fighting for the people who need it. Let's keep going.
Kent Brantley, physician and medical missionary, joins me now. Great to have you, doctor.
Hi, Kira. Thanks for having me.
So the WHO says this outbreak is spreading rapidly. I know you're following it every day. What makes this particular outbreak, specifically concerning right now?
I think this outbreak has a lot of similarities to what we saw in West Africa in 2014, in that it's happening in a region that's been very destabilized by conflict and lots of internally displaced people. It's in a region that is near the border of 3 different countries in a very mobile society, lots of cross-border traffic with the mining industry there. And as in 2014, this strain, although we've developed lots of therapeutics and vaccines for Ebola, they've not been targeted at this strain. This is a different strain, the Bundibugyo strain. And so we don't have the usual tools that have been used over the last 10 years or so to fight these outbreaks.
I know you are very humble when it comes to talking about your own experience with Ebola, and I promise to address the bigger concern here. But could you just tell us what it felt like, Kent, and what kept you positive and how you did beat it?
Ebola is a very fear-invoking illness. You're isolated, you lose control of your bodily functions, with high fever and fatigue and nausea and the rash and the bleeding symptoms. It's really a terrible disease. And I'm so thankful to the many people that took care of me in Liberia, the people who helped evacuate me to Atlanta, and the team at Emory that took care of me. I'm so thankful that so many people said yes and had compassion on me when I was in such great need.
Well, it's clearly inspired your continued advocacy and, how you just are giving back medically and spiritually to all the people that desperately need your insights and your experience. Because one of the biggest challenges right now in past Ebola outbreaks was, containing the disease before, it became so overwhelming and it impacted fragile healthcare systems. So talk to us about the immediate steps that you and your team were able to take in 2014 to try and limit the spread. And do you see that happening on the ground in the DRC right now?
In 2014, I was working at ELWA Hospital just as a general doctor, and the outbreak spread to where we were. So we were very much caught off guard initially, and thanks to some of my other teammates, Dr. Debbie Eisenhut in particular, she really led the charge of helping us get prepared. I think what's happening in DRC right now is very similar in that this outbreak was detected very late. Although DRC has a lot of experience with managing Ebola outbreaks, this one was detected very late, and that means the geographic spread was already very large. And as you can see from a week ago, they were reporting 250 or 300 cases, and now today you're saying 750. it's really concerning how fast this is growing.
It's crazy to think about because in 2014 or 2013 2014 when I first heard about this Ebola, and it was because I was in the ending of high school, so it wasn't even like a serious thing over here, at least in my understanding. We made jokes about it as kids. We didn't even made memes, vines, other videos like that, just not even thinking about the seriousness of the whole situation, just how deadly and how fast it spreads in communities who are already suffering in general or just not as well off as we were. But let's keep going into this.
It's been 12 years, since the outbreak that you dealt with. Are we, do you think, more prepared than we were then?
I think there has been tremendous work done over the last 12 years. There's an organization called NETEC, the National Emerging Special Pathogens Treatment and Education Center. They have done remarkable work with their global partners in preparing, working on protocols and standards and therapeutics and vaccines. But we're in a place right now where it really comes back to those backbones of outbreak management, which are identifying cases, isolating infected patients, and tracing contacts to try to interrupt those chains of transmission.
See, just look at the numbers here. 750 suspected cases in the Democratic Republic of the Congo. 177 suspected deaths. And then in Uganda, you got 2 confirmed cases and then 1 death. It's scary just thinking about how the place you are born can so take away what challenges you have to or dangers you truly face. Let's keep going.
And we need a robust, compassionate international response to come to the assistance of DRC and Uganda and help put an end to this outbreak before it grows larger.
So the WHO still considers the global risk low, but, we all hear the word Ebola and immediately we fear another international health emergency. So what should the public understand, Kent, right now, just about the actual risk?
Look, the average American has nothing to be afraid of with regard to this outbreak.
Yeah.
The risk of it spreading globally, this is not like COVID. It is not spread through the air. It is spread by direct contact with someone who is symptomatic with the illness. And so our concern needs to not be on could Ebola come to America. Our concern needs to be for our neighbors in East Africa, who there are tens of thousands of people in harm's way that need the resources to implement this response, to put up the treatment centers, to do the contact tracing, and we need to come to their aid with those resources.
During the outbreaks like this, we're not just talking about the infection as the only danger. Fear starts to spread among the public. In the DRC, we've been reporting on these medical tents and supplies that were actually set on fire, something the WHO says significantly jeopardized their operations in the area, all operations in the area to try to combat this. So, how do you explain to a community, look, you got to trust us when it comes to treatment?
So they deliberately set the fires because they're not trusting the doctors or not trusting the treatment or that they're truly trying to help?
I've seen the images from that reporting, and it's very disturbing. Ebola has a lot of stigma attached to it, a lot of fear. It requires handling the bodies of the deceased very carefully, which often goes counter to a lot of traditional and cultural burial practices and the ways that people are accustomed to grieving their losses. And so we have to have some level of cross-cultural sensitivity there, and we've got to work really hard at breaking the the poor communication and the miscommunication that happens so often. People are just misinformed.
Well, you're not only a physician, but you're a medical missionary. And God clearly had a plan for you, Dr. Kent Brantley, and you're still doing such great work. We really appreciate you just sharing your story and your insight. Thank you.
Wow. I had no idea that was going on. Let's get over into just a little AI breakdown just to see if we can find out any more information about this whole situation. But let's get over into this AI breakdown. So, like I said, the World Health Organization and Regional Health Ministry are responding to an active and rapid expanding Ebola outbreak in Central Africa, centered primarily around the Congo and the Uganda. So it says that around 750 cases, 82 lab confirmed cases, and there's 177 deaths, suspected deaths. Wow. So they issued this statement on today. So unlike most well-known outbreaks, this epidemic is fueled by a rare virus strain. This poses specific hurdles for contaminants. So no approved vaccines, the highly effective vaccines widely deployed in recent years were formulated specifically for that certain strain and do not provide protection against this new strain. No targeted treatment, so there are currently no approved antiviral therapies or targeted microchromial antibodies available for this strain. Medical intervention is limited entirely to supportive care. Historically, the strain carries a case fatality rate ranging between 25 and 50%, so either between 1 in 4 and 1 in 2 people die catching it. Wow. The international response is heavily restricted by local conditions at the epicenter. The place it is a highly volatile region suffering from armed conflict and massive community displacement. Furthermore, communities' mistrust regarding the medical quarantine and traditional burial practices have escalated. So that's what we've seen in the video where they were burning the tents. Riots broke out at the hospital where angry crowds threw projectiles and set fires to isolated tents after health workers refused to release the infected bodies to the family. Oh, I didn't even think about that. Because they want to bury their dead. They want to bury it in the way that they best feel that brings honor to their family members. And they can't because of the infectious disease. And it's a hard time explaining that. While the health leaders have warned about the high regional spread to bordering nations like South Sudan and the other ones, the WHO and the U.S. Central Disease Control Prevention (CDC) maintain that the global threat remains low. So it can't. They're in general, they're just basically trying to say that it's a low chance that it will come to America, but right there, it's highly spreading. And it's becoming a crazy situation over there just because of the mistrust for the health officials in the first place. Wow. It's a lot of things going on around the world that we don't even think about. But let me know your thoughts on that situation, y'all. Let me know if you disagree with anything I said. Did you know this was going on? Absolutely crazy, y'all. But we will keep up with this and just find out more information we can learn.